the pectoral region, the anterior part or front of the chest is known as the pectoral region, but both words, the chest and pectoral, both are used for the same part of the body. So the word pectus is derived from the chest. The thorax. When we use the word thorax, this word, the thorax, should not be used for the pectoral region. The pectoral region or chest region. The word thorax is used for the underlying structure which are residing in the upper part of the trunk, like the heart, the lungs, the esophagus, trachea, vagus nerves and phrenic nerves, thymus. All are contained in the chest cavity or the thorax, but the superficial part, this part which is connecting the thorax to the upper limb, is known as the pectoral region, or simply this is the anterolateral part. This is the anterolateral part of the uppermost part of the trunk. As we all know, the trunk is having upper thorax and the lower abdominal parts. So when we use the word thorax, it is having this is the chest bone or the sternum. This bone is known as the sternum. These are two collarbones. So we can see here the sternum, which is having three parts. This is the uppermost part of the sternum, known as manubrium. The middle part of the sternum is known as the body of the sternum, and sword-like lowermost part. This beak-like or sword-like structure is known as xiphoid or xiphoid process. So this is the manubrium. This is the body of the sternum. Here we can see the xiphoid process, or also known as xiphisternum. So this part is occupied by the thoracic cage, this part is occupied by the rib cage forming the thoracic cavity. Thoracic cavity is having the heart, the lungs and other visceral organs, but this part and anterior surface of this thoracic cavity is having structures which are essentially connecting the upper limb to the thorax. So this part and anterior surface of this thorax or thoracic cage is having some structures which are essentially connecting this upper limb to the trunk or the thoracic cavity. So this part and this anterior part is the pectoral region, and this is lying in the anterolateral surface of the trunk. There are some muscles connecting the axial skeleton, which is formed by the vertebral column, sternum and by the ribs, to the appendicular skeleton, which is formed by the bones of the upper limb. This bone is known as the clavicle, key-like or italic F-like structure. This is the only long bone, not a typical long bone, which is lying horizontally, and fundamentally it is connecting the upper limb to the axial skeleton. Only one joint, there is only one joint which is connecting the sternum to the upper limb. This is the sternoclavicular joint. So this is the sternoclavicular joint. This is synovial joint connecting the medial end of the clavicle to the upper part of the manubrium, and this notch between the two medial ends of two clavicles is known as suprasternal, interclavicular or the jugular notch. So this is the jugular notch, also known as interclavicular or suprasternal notch. About 5 centimeters below this suprasternal notch, there is a transverse elevation in the sternum or at the junction of the manubrium and the body of the sternum. This is known as the angle of Lewis or sternal angle. So this is the sternal angle, and rib number 2 is attached on the sternum at the level of this sternal angle. So this is the rib number 2. Now, these structures which are connecting the thorax to the upper limb are some muscles, mainly 4 muscles are involved in connecting the axial skeleton to the appendicular skeleton. These are the pectoralis major, the pectoralis minor, the subclavius muscle, and one more muscle, the serratus anterior, which is not connecting directly to the axial to the appendicular skeleton, but it is also involved in the movements of the upper limb, and this muscle lying deep to the pectoral region. But before moving on the muscles, one more muscle which is also involved in connecting the appendicular and the axial skeleton is the coracobrachialis, which is also involved, which is also lying deep to the pectoral region, but it is not strictly a muscle of this region. Now, before moving on the deep structure and the muscles, when we see the skin of the pectoral region, skin is thin in comparison to the skin of the posterior surface of the body. This surface is the flexor surface, the back is the extensor surface. We all know the skin of the all extensor surfaces is thick due to anti-gravity movements or resistance against the gravity. These muscles, these areas are having thick muscle layer, so the thick skin layer, so the skin of the chest region is thin in comparison to the back or other extensor surfaces. When we during dissection, when we remove this skin is made up of the outer epidermis and deeper the dermal layer. When we remove this skin from this area, so we can see here the upper limb or the arm. This part of the upper limb is known as the arm, and below the elbow this is known as the forearm. This is occupied by the thoracic cavity, and this part behind the pectoral region and in front of the scapular region and medial to arm is known as the axilla. This part, which is also known as armpit in layman's language, but here in medical terminology we will use the word axilla. Floor of the axilla is known as the armpit. This is having the skin. When we reflect the skin, we can see the fatty superficial fascia. The word fascia is used for the bond. and this bond remains continue with the fascia of the abdomen, with the fascia of the axilla, with the fascia of the neck, and also with the fascia of the scapular region. So, this fascia, the superficial fascia, and it is having some important structures. This fascia is having some important structures like the nerves, the arteries, the veins, and some modified glands, especially in females. So, here we can see the cutaneous nerves. These cutaneous nerves are branches of the cervical plexus and are the branches of the intercostal nerves, the anterior rami or ventral rami of the intercostal nerves. The vessels which are supplying blood to the pectoral region are branches of the internal thoracic artery and also branches of the posterior intercostal arteries. The breast. This part, the breast, well developed in females, very well developed in the time of the pregnancy and during the lactation, but almost rudimentary in males and the girls before teenage or before the menarche. So, these are rudimentary in males, rudimentary in young females before the time of the puberty or menarche, but well developed after the time of the menarche and the teenage, and very well developed in the time of pregnancy and lactation. So, this is a modified sweat gland and most important structure of the superficial fascia of the pectoral region. I will talk about the breast or mammary gland in a separate lecture, and one muscle which is also lying inside the superficial fascia of the pectoral region, the platysma. The platysma is used for some broad structure. So, this is a broad muscle taking origin from the deep fascia of the pectoral region, or also known as pectoral fascia, running upward and medially and inserted on the base of the mandible. So, the cutaneous nerves. First of all, I will talk about the cutaneous nerves of the region. There are three nerves which are coming from the cervical plexus. There are three nerves which are coming from the cervical plexus. Piercing the deep fascia above the clavicle and taking origin from the cervical plexus, C3 and C4. These three nerves which are coming from the cervical plexus above the clavicle and downwards to supply the skin from the clavicle up to the second rib. So, these three cutaneous nerves are known as the lateral, the intermediate and the medial supraclavicular nerves. So, these are the medial, the intermediate and the lateral supraclavicular nerves. This part below the second rib is innervated by the anterior and lateral cutaneous nerves. These are the anterior cutaneous nerves taking origin from the ventral rami or anterior primary rami of T2, T3, T4, T5 and T6, taking origin from T2, T3, T4, T5 and T6. These are the anterior cutaneous branches derived from the anterior primary rami of T2, T3, T4, T5 and T6. This part is innervated by T3, T4, T5 and T6. This is T3, T4, T5 and T6. Here we can see one more nerve. This nerve is modified lateral cutaneous branch of the ventral rami of the T2, and this nerve is known as intercostal brachial nerve. The term intercostal is derived from the intercostal spaces and brachio is derived from the brachium. the arm is also known as brachium. So this is the intercostal brachial nerve. These supraclavicular nerves are innervating the upper part of the deltoid, the cutaneous innervation, not the muscle, and the part of the pectoral region between the clavicle and the second rib. This intercostal brachial nerve is innervating the floor of the axilla or armpit, the medial side of the arm, and part of the pectoral region. Below this, lateral part is innervated by T3, T4, T5, T6. These are branches of the ventral primary rami of the thoracic spinal segments. This part, the medial, is innervated by T2, T3, T4, T5 and T6. There is an interesting situation. Why this is interesting? When we notice this all innervation, we can see interesting and special point of interest. This part is innervated by C3 and C4, and this part is innervated by T2, T3, T4, T5 and T6. Where are intervening C5, C6, C7, C8 and T1. So where are intervening C5, C6, C7, C8 and T1. If you can recap the embryogenesis or development of the upper limb, you can see during development these upper limbs and lower limbs are simply extension of the torso. Upper limbs and lower limbs are simply extension of the torso or the trunk. During development, this upper limb bud is pulled away from the trunk, and with this pulling, the anterior primary rami or ventral primary rami of C5, C6, C7, C8 and T1 are also pulled away to form a plexus of nerve, a grid of nerve, or tangle of the nerve known as brachial plexus. So, anterior primary rami of C5, C6, C7, C8 and T1 are pulled away to form brachial plexus to innervate the muscles, joints and skin of the arm, forearm and the hand and the digits. Now, when we talk about the vessels of the region, there are perforating arteries accompanying these anterior cutaneous nerves. These are branches of the internal thoracic or internal mammary artery, which is a branch of subclavian artery. So these are branches of the internal thoracic artery, which is a branch of the subclavian artery, and the other branches which are accompanying the lateral cutaneous nerves and perforating are branches of the posterior intercostal arteries. So these are branches of the posterior intercostal arteries. The second, third and fourth anterior intercostal arteries are enlarged to supply the mammary glands or breast in females. Second, third and fourth perforating arteries from the internal thoracic, also known as internal mammary artery, are in supplying the blood or vascular supply to the breast or the mammary glands. The platysma muscle, I will talk about platysma in brief, taking origin from the pectoral fascia or deep fascia, and fibers are running upwards and inserted on the base of the mandible, and this muscle plays key role to make the skin tense, the skin of the neck tense, or lowering the angle of the mouth like this, and this action is used by the during the time of the shaving, so also known as shaver muscle. So fibers are running upward, superficial to the clavicle, and inserted on the base of the mandible. So this is the platysma. Also known as shaver's muscle. And this is innervated by the cervical branch of the facial nerve. The facial muscles are innervated by the facial nerve, the facial expression. So this is also considered as the facial expression muscle, and these muscles are originated or derived from the panniculus carnosus and having great importance in lower animals like the buffalo and cow. So this was about the cutaneous nerves, vessels, and the platysma muscle. In next lecture, I will talk about the very special or modified organ of the superficial fascia of the pectoral region is the breast.